Hello, how are you all? Hope you are fine and preparing well for IMC Part 1 examination. We are solving AMC Part 1 recalls from the Gynae section. These are some tricky questions. Hope this will be helpful for you. Let's start. A 50-year-old woman present to your GP practice because of persistent vaginal bleeding for the last 3 days. Her last menstrual period occurred 1 year and a half ago. She mentioned that just before the bleeding she felt reduction in the hot flushes and she has been experiencing for the past year. She is sexually active and has a regular pap smear with a normal one 6 months ago. Which one of the following is the most likely diagnosis? A. Endometrial cancer. B. Cystic glandular hyperplasia. C. Atrophic vaginitis. D. Cervical cancer. E. An episodes of follicular ovarian follicular activity. So this is one of the trickiest question because they have mentioned two statement here. One is that her last menstrual period occurred 1 year and a half ago. So this indicate that she has achieved her menopause. What is the cutoff duration for menopause? The cutoff duration, if the patient is 45 year or older, if the patient is 45 year older and she has not menstruating for 1 year or 12 month, then we are labeling that patient as menopause. But they have tricked in this question. What is the trick here? They again mention in the statement that patient mentioned that just before the bleeding she felt reduction in the hot flushes. So we all know that menopause have a premenopausal and menopausal patient is having some vasomotor symptom because of gradually falling down of the estrogen. So what are that vasomotor symptoms? These are the hot flushes, increase sweating at night, patient faced increased sweating, as well as insomnia, mood swing. So here they have tricked in this question. It is that she felt reduction in the hot flushes. What it is this statement indicating? This statement indicating that even she is not menstruating from the last 12 months, from 1 year and a half ago, but this statement that she felt reduction in the hot flushes indicates that she has even have no not there is a fall of the estrogen and she is not facing the menopausal symptom or premenopausal symptom. So somewhere estrogen is there from the ovaries, so that's mean that ovaries are still working. This is statement indicating that ovaries are still working and estrogen is still there. Correct answer is this is an episode of ovarian follicular activity. Because of this statement, the diagnosis is completely changed here. Okay, what if this statement is not mentioned? What you will mark if this statement is not mentioned in the question and they will ask you that patient is having a menstruation 1 year and a half ago and patient is 50-year-old, and they will ask you for the most likely diagnosis. What you will mark in that scenario? So always remember is if the patient is in the menopausal phase and is if she is having a persistent or she's having a postmenopausal bleeding, then the most likely diagnosis or most likely cause and most likely diagnosis will be atrophic vaginitis or vaginal atrophy. So atrophic vaginitis or vaginal atrophy in that scenario. Sorry. Okay, so in that scenario, if there is this statement is not mentioned that she's having a reduction in the hot flushes, and I will ask you with the postmenopausal bleeding the most likely cause or most likely diagnosis. So in that scenario, atrophic vaginitis or vaginal atrophy will be the correct answer there. But here they have put this statement. So uh, the correct answer is an episode of ovarian follicular activity. One more thing I want to discuss here. Whenever the patient is facing postmenopausal bleeding, whenever the patient is facing postmenopausal bleeding, we have to have investigate all the patient with the postmenopausal bleeding with transvaginal ultrasound. So in case if they will ask you about the next investigation, always mark transvaginal ultrasound with postmenopausal bleeding. What we will see in the postmenopausal bleeding with the transvaginal ultrasound, we will see the endometrial thickness and what it defined if endometrial thickness is greater than 4 mm, then it defined that patient is having endometrial hyperplasia, and this is a strong indication to perform endometrial biopsy to rule out endometrial cancer in all women with patient or in all patient with postmenopausal bleeding. Please remember this point. So cervical cancer is not the correct choice here because she is having a regular pap smear with all normal results. Atrophic vaginitis I already explained, where you will mark atrophic vaginitis if they will ask you the most likely diagnosis. Yes, cystic glandular hyperplasia could be the cause of postmenopausal bleeding, but it is very uncommon and we have to rule out in all patient the endometrial hyperplasia with transvaginal ultrasound investigation. Endometrial cancer we can diagnose once the biopsy result uh, will show that endometrial cancer is there, then we can diagnose that case as endometrial cancer. So here the correct answer is an episodes of ovarian follicular activity. This is one of the tricky question, so let's read the explanation. Correct answer is E. When menopause occurs, estrogen level fall. Decreased estrogen level result in increased production of follicular stimulating hormone and a very high level of circulating FSH. At times, these high level of FSH causes a remaining follicle to become active, resulting in menstruation. As such occasions produce estrogen by the active follicle lead to decreased symptoms of menopause such as hot flushes and vaginal dryness, etc. Okay, one important point I want to discuss here. So and sometimes they are asking with the menopause or which hormone levels will be increased. So always remember that there will be increased production of follicular stimulating hormone. What is the mechanism behind for the increased production of FSH? Actually, ovaries secretes estrogen whenever ovaries are functioning in the normal reproductive age. Whenever the ovaries are functioning, it produce estrogen. What estrogen production done to the pituitary? Estrogen give the negative feedback to the pituitary to stop FSH secretion. So, in the normal reproductive age group, FSH will be in the normal range. But in the menopause, this ovaries stop working, and whenever the ovaries are stop working, the estrogen levels will fall. Whenever the estrogen level fall, it will not give the negative feedback to the pituitary, and pituitary keep on secreting the FSH, and FSH will be always high. This is one of the investigation to confirm the menopause, that FSH will always high, will be always in a higher level with the menopausal age group or premenopausal age group. So this is one of the investigation which we are doing to confirm the menopause. Otherwise, the symptoms will be hot flushes, vaginal dryness, insomnia, and the mood swing will also there in case of a patient is 45 year or above. So option A, endometrial cancer could be a possibility, but it is very uncommon in premenopausal women or those within the first 2 3 years of their menopause. But we have to have rule out in all patient of the postmenopausal bleeding. You have to have rule out the endometrial cancer by doing the transvaginal ultrasound. And if transvaginal ultrasound showed endometrial hyperplasia, endometrial thickness greater than 4 mm, we have to go for endometrial biopsy to rule out endometrial cancer. So atrophic vaginitis present differently with decreased vaginal lubrication, dyspareunia, vaginal discharge or bleeding or dysuria. Option D, with the normal cervical screening 6 months ago, the cervical cancer is very unlikely. We already discussed. Thank you very much.